How long does it take to recover from runner's knee? Well, it depends on what treatment you're doing, and if the treatment is focused on treating the pain in the short term or treating the root cause of runner's knee. And here's what I mean by that. Let me break it down for you. The most common treatment given by doctors and recommended by Google, and most people will tell you that if you want to just recover quickly from runner's knee, just rest it, stop running. If you stop running, you'll probably get better within 2 weeks if it's mild runner's knee, 4 weeks if it's moderate, probably about 2 months if it's severe. But as soon as you get back to running, the pain is likely to come back. It might come back right away, it might come back 6 months in, but either way, the root problem hasn't been addressed, so you're liable to have the problem return once you get back to running, which in my opinion, at that point, you haven't really healed from runner's knee. You've just made it dormant, and you have gotten back to running if you didn't get pain right away, but if you're liable to get the problem again, then you haven't solved this for the long term. Other treatments that doctors might give you is pain medication and pain injections. These treatments can help you to get rid of the pain sooner, but it doesn't fix the root problem, which is a muscle imbalance. That muscle imbalance needs to be addressed in order for you to have true long-term relief from runner's knee so that you can get back to running as much as you like without the pain coming back in the front of the knee. Let me explain the muscle imbalance to you. In runner's knee, you've got the kneecap right here on the front of the knee. There's usually pain somewhere in the front of the knee right here. Very often the muscles on the front of the thigh, the quad muscles, are too strong and they're yanking up the kneecap against the thigh bone, causing there to be excessive pressure in the area. If you can shift from using the quad muscles to run primarily, instead to using other muscles, usually the glute muscles up in the back of the hip, then you can reduce the amount of force that's going to go through this joint and relieve the irritation that's there. Then you can run theoretically as long as you can, as long as you intend to, without overstressing the cartilage and the rest of the tissues on the front of the knee. That right there is the cure. If you can fix that problem, the amount of pressure going through the front of the knee, behind the kneecap, then you can unlock unlimited amounts of running for yourself. In order to fix the root muscle imbalance, you have to get the right education and guidance on doing this. And most physicians aren't going to be educated on this. They're trained on doing medications, on giving you medications, injections. And if they're trained as a surgeon, then they're trained in doing surgery. Now, sometimes you'll have these doctors refer you to a physical therapist, and most physical therapists are excellent at helping people recover from surgery or a debilitating sickness or some problem that they had. But what they're not usually specialists in right out of school is helping people recover from problems like these, like runner's knee, without having surgery, without relying on injections or pain medications. They're great at helping people getting back to normal after having a knee replacement, an ACL reconstruction, or after having to go into the hospital for some heart problem and they get really weak and they have to get back to walking and getting in and out of chairs normally again. That's what physical therapists are absolutely superb at. But specialty physical therapy is needed in order to fix a knee problem like runner's knee so that you can get back to running marathons or even just 5Ks and 10Ks without worry that your knee's going to get worse. If you're looking for guidance, for education on how to solve this problem, hang out here on our channel. If you haven't already subscribed, please hit that subscribe button so that you don't miss out on any of the helpful videos that we post each and every week. And also go down into the description below this video and you'll find a playlist called the Runner's Knee and Jumper's Knee Help Playlist. It's loaded with all our videos specific to runner's knee. But there's also a program that I need to tell you about. It's called the Patella Pain Recovery Program. This program is an online course that you can register for and get access to 30 videos, over 30 videos of me walking you step by step through how to resolve the root problem of runner's knee. These are not videos available on YouTube, but these videos are as if you were here in person with me getting treatment by me. I walk you through all the phases of healing, all the way to getting back to running for as long as you want without knee problems. We even cover jumping in that program. There's so much that you need to learn in order to resolve runner's knee for the long term. If you're a runner, chances are you've been running for a while and you intend to run the rest of your life. You probably want to get to that person who's in their late years and still running. Everybody knows that person. If you're in a runner's group, there's that person that's in their 70s or even 80s. Or if you've ever been to a 5K or a 10K, it is so inspiring to see that person that looks like, that surprises you, that you wouldn't think they could run that much, and they're still running a 5K or a 10K in their last decades of life. You can be that person if you can solve this runner's knee problem at the root, at the muscle imbalance, and get back to running without worry about your knee hurting. Hey, if this video was helpful for you, please give us a thumbs up. Drop a comment if you have a question. If you want to just update us on how running is going for you, also comment in there. Please share this with somebody you think needs to see this as well. Thanks for watching, and I'll see you in the next video. Bye.